Hey guys, alright, so today we're going to have a really interesting discussion about ozone. And while there's an extensive history over the past several hundred years where ozone has been utilized for therapeutic purposes, there still remains a question as to which method of administration is right for me and will have the greatest effect. Over every 5 years, practitioners, scientists, and other ozone leaders gather and coalesce their clinical evidence, the research studies, into what's called as the Madrid Declaration of Ozone Therapy. Today, we will address some of the most recent findings and a few other related questions. Hi, I'm Dr. Tim with Optimized Wellness Center, your premier health and wellness center offering functional medicine services, chiropractic care, and other innovative therapies to local residents in the Bay Area, as well as telemedicine and mobile concierge care remotely. Please take a second and subscribe to our channel and click the like button. All right, guys. So a popular saying in the ozone therapy is ozone treats many things but cures nothing. Most importantly, it fundamentally helps the body rebalance and heal itself, similar to the processes of hormesis or the way in which adaptogens function. Let's take a second and touch on some of the history, as this may be the first time that some of you have heard about ozone therapy and others may be familiar with ozone, yet not some of its origins. In 1785, Van Meurens first identified the distinctive odor associated with ozone, but it was named after the Greek word for smell, later by German chemist Christian Friedrich Schonbein. About 70 years later, ozone was widely being utilized in the operating rooms as an antiseptic as well as a disinfectant for surgical instruments. At about the same time, ozone was being used for water treatment in Monaco. And then fast forward to 1896, Nikola Tesla, the guy who we think of as being one of the greatest inventors of our time, patented the first portable ozone generator, which was further improved by physicist Joachim Hansler. Since then, ozone has been found to be helpful in treatments of more than 50 pathologies. In particular, it plays a role in altering the endogenous, meaning internal, oxidative-antioxidative balance. Many have reported oxygen ozone therapy as being non-invasive, non-pharmacological, low-cost, and with no or limited side effects whatsoever based on the antioxidant capacity of ozone. It has been reported as assisting with conditions including cardiovascular, peripheral vascular, neurologic, orthopedic, gastrointestinal, and genitourinary pathologies, including things like fibromyalgia, skin diseases and wound healing, diabetic ulcers, infectious diseases, dentistry, lung conditions, osteomyelitis, and importantly, some of the most prevalent cognitive and motor disorders in the elderly, otherwise known as neurodegenerative conditions, like Alzheimer's disease, Parkinson's disease, ALS, Huntington's disease, and multiple sclerosis. These aging-specific diseases are characterized by the loss of homeostasis during aging, leading to a low-grade stress by pathologic formations of what's called as reactive oxygen species, or ROS, chronic inflammation, and then there's also mitochondrial dysfunction in addition to metabolic unbalances. Oof. That's a lot going on, and hence it leads to these neurodegenerative conditions. Ozone and NRF2 play a central role in signaling the antioxidant, anti-apoptotic, pro-autophagy effects involved in aging and in neurodegenerative disorders. So we will discuss this in greater detail in a separate video, but I just wanted to give you a little bit of a snippet of how powerful ozone can be. So ozone administration dissolves immediately and reacts with what's called as PUFAs, or polyunsaturated fatty acids, leading to the formation of hydrogen peroxide and lipid oxidation products, or LOPs, among other things. It will have effects on superoxide dismutase, or SOD, glutathione peroxidase, heat shock proteins, cytochrome P450 monooxygenase, among other things. I know those are a lot of really big scientific words, but for those of you that are in this space may already be familiar with it and not entirely clear that ozone is going to have a positive effect on those things. So ozone inactivates oxidative stress and apoptosis. Ozone modulates the degeneration of protein synthesis, or otherwise known as autophagy. It generates nitric oxide via NF-kappa B pathways. This means that when we get nitric oxide, our blood vessels, as one example, get to dilate better. In addition, ozone affects what's called as the rheology, or the flexibility of our red blood cells, which means that they can pass through very small holes and pathways and get down to the distal ends of our fingers and our other areas of our body. Ozone neither damages erythrocytes nor induces oxidation of intracellular hemoglobin. Ozone also activates the immune system, anti-inflammatory signaling, proteasomes, it releases growth factor, it improves blood circulation, and has antimicrobial activity with potent effects on the gut microbiome. I know, that's a lot. Well, so you can now understand how so many people can have positive effects associated with utilizing ozone. And so many of us have one of those things or a multitude of those things potentially going on, whether we're aware of it or not, and so this could be beneficial. In general, we think of ozone application as either being administered locally or systemically. So let's talk about some of the local treatments. Well, so when we're thinking of local treatments, we're thinking of a specific region like the mouth or the hand or the vagina, in ways in which it may benefit by applying ozone in a very local mechanism or local means. Local treatments are typically used for infections and speeding up the healing process. An example would be washing an infection on the skin with ozonated water, or other methods of local treatment may include wound bagging or cupping. Well, local treatments are commonly used for infections, non-healing wounds, ulcers, and cavitations in oral infections. By contrast, systemic treatments, these are the treatments that work more broadly through the entire body by means of dissemination. In the third Madrid Declaration of Ozone Therapy states that vaginal ozone insufflations are as or more powerful systemically as a treatment than rectal insufflation in even MA, or otherwise known as major autoimmunotherapy, and with pervasive effects by utilizing vaginal insufflation. In this case, it is commonly used for chronic conditions, infections, autoimmune diseases, gut diseases like IBS, or anti-aging and longevity, biohacking, mold toxicity, Lyme disease, and for professional athletes and non-professional athletes. According to the science, ozone therapy seems to stimulate some of the same pathways as exercise and even intermittent fasting. Ozone therapy is commonly used among professional sports, including soccer, NFL, NBA, MLB, CrossFit, UFC, cycling, and more. It is said to increase the stamina and endurance, as well as improving oxygen metabolism and reducing muscular fatigue while expediting recovery. And as athletes know, playing a sport is all about how quickly can you recover and go back out and play again. Some examples of athletes using ozone include American football running back Adrian Lewis Peterson, or Moldovan professional martial artist, Ian Nicola Kudalaba, excuse me for the pronunciation there, and Portuguese professional footballer Cristiano Ronaldo dos Santos Aveiro. Alright, so while it is awe-inspiring to watch some of these professional athletes share their amazing skills and abilities to recover, but how does this relate to me? Some people are still concerned if it is the right thing for them. After decades, some of Ozone's basic mechanisms of action in pulmonary toxicology and in medicine have been clarified. Prolonged inhalation of ozone can be very deleterious, so we do not recommend this. On the other hand, small dosages of ozone are well calibrated against the potent antioxidant capacity of the blood and can trigger several useful biochemical mechanisms and have a reactive antioxidant, reactive effects in the antioxidant systems. So you might ask, how do we calibrate the dose based on my antioxidant capacity? Well, that is a discussion for another video, but in short, at my clinic, we use a Nobel Prize awarded technology that non-invasively, this device is able to diagnostically tell us within less than a minute your ability to deal with stress and inflammation. This gives us individualized information about your antioxidant capacity and whether there is mitochondrial dysfunction, and it is one of the ways to address this question, and maybe as it relates to whether I need ozone therapy and some of its benefits. So guys, I wanted to take one last moment and share with you exactly how we may do some of this. All right, so we would start with medical oxygen, and then we would utilize an ozone generator. This is just one of the generators that we have. And this one here acts just like lightning. So when you go outside and the rain is just beginning and the lightning is there, that lightning strikes and it takes oxygen and it splits it. And this becomes very reactive and it doesn't want to be alone. And so it's going to glom onto another oxygen. So the O2, and then this other one becomes O3, otherwise known as ozone. Now we can then fill that into an ozone-safe bag as one of the mechanisms of capturing that ozone, and then you can use a catheter to be able to administer it into the vagina, as we were just talking about, one of the best systemic mechanisms of administration, but not all of us have a vagina. So, in which case we could put this and utilize this as a rectal insufflation into the rectum, and subsequently some of that ozone will pass into the bladder and up into the stomach as well. We can also administer it through nasal cannula, and we can do wound bagging and various other administrations. And so I encourage you to look at some of our other videos where we talk about that in depth. Alright guys, thanks for taking the time to listen to this video. Don't forget to press the like button and subscribe to our channel. Check out some of the other videos, and I'll look forward to catching up with you soon. Take care.